I apologize. Now we want to fight. Okay, here we go. So I am Erin Howell. I work with Vivint Health. We have an office in Beloit, which is the one that I work out of. We also have one in Madison. We have several others in the state of Wisconsin, as well as in Denver, Colorado, St. Louis, Missouri, and then just newly in Austin, Texas. So we're going to be going over the opioid overdose response. Just kind of an overview of what we're going to touch on is Vivint Health and our different programs that we have, just in case anybody's never heard of us. The harm reduction theory, what opioids are, how does an overdose actually occur, some of the signs and symptoms, a few statistics. I always like to share local ones more than national, just because for me, I feel like that's in our backyard and it's good to know what's happening. Also, I'm going to go through how Narcan actually works. Then going through the quick start guide with the Narcan and then doing the demonstration. And then again, if people have questions, you don't have to wait till the end. We can address them as well. So Vivint Health has a vision and a mission that I just want to share with everyone so you know who we are and what we're all about. Our vision is that we envision a world without AIDS and strive to assure that everyone with HIV lives a long and healthy life. The mission is that we are a relentless champion for people affected by HIV and do all that we can to help them thrive, because we believe every person has value and should be treated with respect. So again, I mentioned that we have several different locations. This slide doesn't have our Texas location, but we are in 4 different states. So we do have locations all over. And at any time, if someone does need to have their Narcan replaced, you can go to any of our offices and let them know that you did a training, and they will replace that for you for free. So some of our programs that we have for prevention actually include CTR, which is counseling, testing, and referral. So I do testing for hepatitis C, HIV, and syphilis here at our Beloit location. We do distribute condoms and lubricant for people. So I'm part of the LifePoint Needle Exchange program. With that, obviously comes the opioid overdose training. We also do outreach to men who have sex with men, trans and gender non-conforming individuals. Then we do PrEP, which is pre-exposure prophylactics, and then research as well. So kind of touching on what the harm reduction theory is. So basically, harm reduction can be applied to anything. It could be diets, quitting smoking, or any small achievable goals. Basically, we're approaching drug use from a realistic and pragmatic public health perspective, recognizing that whether we like it or not, drug use is a part of our world and it's happening in our communities. So setting practical strategies that reduce negative consequences of drug use, including poverty and crime and other risky behaviors, is part of that theory. Basically, we're accepting that licit and illicit drug use are a part of our world, and we choose to minimize the harmful effects. So basically getting people the help that they need right now. So part of the needle exchange program actually includes getting clean supplies for people, so that ensures that there are not spreading different diseases, and then doing the testing as well. So again, that's helping people to to know their status and to not spread any further disease. So jumping right in, what is an opioid? There are the heroin, the fentanyl, and carfentanil, which are pictured there. Again, we've got many different synthetic, and then unfortunately in the Milwaukee area, we're seeing another synthetic opioid. It's called ISO. It is as powerful as fentanyl, if not more. So if you're looking at the heroin in that little bottle there, that amount of heroin and that tiny amount of fentanyl and that one little grain of carfentanil basically do the same thing. So basically an opiate is a drug that was naturally derived from an opium poppy plant, which I'm sure everybody knows. It's been around for thousands of years. So heroin, morphine, and codeine are some of the natural forms of it. Synthetics obviously would be fentanyl, carfentanil, the ISO. Semi-synthetic ones would be like Vicodin, Oxycontin, Percocet. Unfortunately, most of the fully synthetic ones are like 30 to 50 more times, 3,000 to 5,000 more times stronger than just regular morphine. So it's definitely a significant and scary drug there. So the basic science of an opioid overdose. So what we're looking at right there is the opioid receptors on the brain and the opioid. So when it actually enters the brain, it's going to involve suppressing the breathing. It can actually affect the oxygen that reaches your brain. Any kind of short or long-term psychological and neurological effects, including a coma. It could also include coma and brain damage. So obviously you want to try to get someone breathing immediately. So basically when people are putting that drug into their system, the opioid fits just perfectly on those opioid receptors on the brain. And it just caps right on there. And that's when you start to see the different signs of an overdose. So some signs jumping right in, basic things, face being extremely pale or clammy to the touch, blue or purple cast of fingernails or lips. I've seen that before. The small pinpoint pupils. Most people, when you tell them that, it's confusing. No one's really, if you don't see that ever, you don't know what that means, but you literally, it's almost like you can't see the pupils there. Their body goes completely limp. One thing that we're hearing quite a bit, unfortunately, with the fentanyl is people will be completely alert and awake and having conversations with people, and then they'll fall out, which is, going limp and not being able to talk, and then coming back and then falling out again. So unfortunately, in that case, you definitely want to stay with that person and make sure that, they're not putting anything else into their body. Unsteady walking, mood swings, those things definitely happen. Any kind of confusion or delirium. So just a few statistics. Overdose deaths, involving prescription opioids have actually quadrupled since 1999. And also looking at that, the sales of prescription drugs have as well. So that's one thing to keep in mind. A lot of people just assume that someone who is overdosing will be someone who is, a junkie on the street or someone who is using illicit drugs. It can be, grandma, it can be the lady next door, it can be, whoever. If anyone is taking any type of opioid, it can definitely be them. The other thing that to point out, 85% of overdoses are witnessed. Unfortunately, many times people are actually there and seeing overdoses. They're not always calling the police or the EMS, and sometimes they don't have the Narcan to bring them back as well. So that's an unfortunate statistic. Just looking at some national data. So basically this is all opioids. You're looking at this. So the female is the yellow line, the males are the orange. You can see that it's definitely affecting males a lot more than females. If we look at the next slide, this one is specific to heroin. Significantly more. You'll see quite a few more deaths involving heroin for the male population. I would say, so I pulled numbers. The most recent that I could get for Rock County was actually June's numbers. So reported suspected overdoses that we had in the county, there was 18. That's not necessarily deaths. That's just 18 people that had called requesting assistance because of an overdose. And looking at that, we're really looking at high numbers of males as well. The one thing to point out, in the females, we're looking at a significant amount. We've got 5 of those 18 that are actually over than 85. So again, remember that just because, typically people hear and assume that an overdose is happening, it's someone who's using an illicit drug. I think more often than not, it happens to be someone who is using a prescribed medication and maybe forgetting that they've got it, in their system already, or however that affects them. So touching on what I do with the LifePoint Syringe Access Program, we do offer it in all of our Wisconsin offices. So last year in 2019, we distributed 5,002,004 needles. That actually was 43,000 exchanges. So the biggest piece of what we do is forming relationships with people and basically building their trust. So looking at drug treatment referrals, we had 3 million of those last year. So a lot of times people are confused and think that, the LifePoint program just basically supports people's drug use and, there's no need for us. But what we're really doing is, helping people, meeting them where they're at, and then when they're ready and they decide that that's something that they want, getting them into treatment as well. And just kind of breaking down data according to our offices. So again, I'm in the Beloit office. Of those numbers, I distributed 141,450 needles, which equates to about 2,200 people that we served. And then we had about 113 treatment referrals for clients, which is it's a pretty good thing. And already this year, even with COVID happening, we've seen quite a few people who are choosing to go into treatment as well. So some of our data regarding naloxone or Narcan. Narcan is the brand name, just in case anybody wonders what the difference is. So we trained 8,837 people newly trained. We distributed 43,414 doses of naloxone, which actually we had 1,521 overdoses reported, or overdose reversals reported. So one thing with the data that I collect with the LifePoint Needle Exchange Program, I do ask people when they come in if they've had to use Narcan. I ask them if when they've used the Narcan, where it happened, how many times they had to use the Narcan, like how many doses they had to use on a person, if they also tested it for fentanyl. So one of the things that we do, we have fentanyl test kits in our office, and we actually distribute those to people. So that way, when people are choosing to use drugs, they can actually test their supply, and they'll know ahead of time if they have fentanyl in that drug. At that point, they can decide if they want to dispose of it, use it a different way, maybe use it with someone else. Basic, harm reduction behaviors. So then looking at some data, this is kind of what I was referring to with the peer saves reported. In Beloit, we had 112 people that reported to us that they saved an individual. Many times I would say, so I do look at the DHS website and I look at their data. Compared to my data, I would say for the most part, I'm about double what they're at. So most times people are not calling 911 to report an overdose, which is unfortunate. I'm trying to get that to change. So looking at how naloxone works in the brain, again, that opioid fits right on that opioid receptor. It fits just exactly perfect how it's supposed to. Now, when you introduce the Narcan into your body, it actually is gonna, almost like a volleyball, just pop right in there, and it moves that opioid right off of that receptor. The one thing to note, so unfortunately, the opioids will stay in the system, in someone's system, a lot longer than the Narcan will. So typically Narcan will last about 30 minutes to about 90 minutes. So it's important to make sure that if you do administer Narcan to someone, hopefully you're calling 911 and the EMS are there. However, if you are there with them and they haven't decided to go to the hospital or wherever they need to be, someone needs to sit with them for several hours probably, just to ensure that they don't re-overdose. So it does happen where people can actually have opioids come into their system. And the Narcan, they bring them back, everything's good. And then, hour and a half later, they re-overdose without actually introducing something into their system. And I'm just looking really quickly. I see that there's notes, but I can't see them right now. So as soon as I'm done sharing, I'll go back to them. So shelf life of nasal Narcan was 18 to 24 months. Actually, this year, they just updated that, so it's actually good for 36 months. So if anybody already has Narcan currently, it actually will be good for another year beyond that date that's on the box. It is sensitive to temperatures, so make sure you do not keep it in the sunlight. Don't keep it in your car, obviously in the cold and the hot. If something would happen where you would actually, it would get too warm or whatever and you bring it in the house, about an hour at room temperature and it should bring it back to normal. But again, any Narcan is better than no Narcan. So even if it's been exposed to, the temperatures, you still want to use it. Unfortunately, with many of the synthetic opioids being out there, it's pretty common that people will have to use multiple doses. Typically what I'm hearing, at least from my participants, is 3 to 5 doses. So it's a really good idea to make sure that you are calling 911 when you start to administer that Narcan. So kind of looking at this here, what to do. I know the question was posed right away. How do we know if someone's overdosing? So you'll notice somebody is actually probably nodding out, or they might be turning blue. If you're shouting at them and they're not reacting to you in any way, shape, or form, you can also take your fist. You'll actually, make a fist with it and rub right on your chest bone, rub hard, or you can rub right underneath the nose. Those two places are pretty sensitive, and if you're rubbing someone like that, that's going to hurt them. If they are overdosing, they're not going to react to that. So that's one sure way to know that that's happening. One thing to note, so Narcan it's not harmful to anyone. You can't overdose on it. So if you see someone and you think that they truly are overdosing and you give them Narcan, it's not going to affect them in any way as long as they're not taking an opioid. The one exception to that, so any women that are pregnant in that first trimester, if they're overdosing and you administer Narcan, the risk of a miscarriage is a little bit higher than in the second and third trimester, because that fetus, that baby, will immediately go into withdrawal, and in most cases it's unable to survive that. So kind of jumping back to when you walk up to someone and they're, you think they're overdosing, shout in their face, shake them if you have to. Don't do anything crazy where you're going to hurt them and break any bones or anything like that. If you're alone, you can choose to call 911 and get your Narcan right away in hand to do that, or you can, administer the Narcan first and then call 911, whichever your preference is. The one thing that works the best, so nasal Narcan can be absorbed through the mucous membranes. So it will, even if they're unconscious, it will still absorb right in there. It's easiest to work with gravity. So if you have someone who's sitting in a chair, for example, the best thing is to get them out of that chair and lay flat as they can. Because if they're sitting up and then you administer the Narcan, a lot of the gravity will pull that right back out. And obviously you don't want to have to give them too many doses. Rescue breathing is recommended. It's not required. So some people, if you don't feel comfortable doing rescue breathing, that's not something that you have to do. I do give out masks to anyone that, wishes to do that, especially with the COVID-19 happening right now. People want to be protected. CPR is not something that we typically recommend because in most cases, they're still breathing and you don't really need to administer CPR at that point, unless when you're on the phone with the EMS or the dispatcher, they tell you to start administering CPR. I wouldn't just start that on your own. So Narcan comes in several different forms. The one that I have here that I distribute the most is the nasal Narcan. I do have the intramuscular as well, but that's a few extra steps. So one important thing is obviously not to leave that person until help arrives. Obviously, we kind of touched on, how Narcan will wear out of the body faster than the opioid does. So it is possible to have them re-overdose. If you do have to walk away from someone for just a moment, the recovery position is very helpful. So it's kind of weird to see that little man there, but you put the hand underneath the head, so it's going to actually support that head. The knee out front is going to prevent that body from rolling onto the stomach or actually rolling on their back. So if they are vomiting or there's anything in their airways, you don't want them to fall back on their back and then swallow that and choke. Skip that. Okay, so nasal Narcan spray. I'm going to really quickly, I think, unshare my screen just so you can actually see me do this. Okay. Can you, there we go. Okay. So the nasal Narcan, each one comes in a foil package, and each one is packaged separately. So they look like this when they actually come to you. They're just these little, and then there's the foil package in the box. On each box, there's also a little, basically a run through, like steps 1, 2, 3, 4, 5, kind of tells you what to do. But the easiest thing is, so once you open that foil package, the nasal Narcan looks just like a little nasal spray. You're going to take your index finger and your middle finger and put it right there. The bottom one where it's easiest where your thumb is, okay? And you're going to put that right up in your nose, right to kind of where the bone is, but even when your fingers are going to touch the bottom of your nostrils, and you just push. So I don't need to do it because it's a demo, but you'll just push right up there. It's just one spray. You don't need to prime it. Again, I would say about 2 minutes in between if you do need to do another spray for someone. Unfortunately, that does happen. Excuse me. I'm going to bring this back to here so you can see what's happening. Maybe. Okay. So again, that's the box there. There's a little guide on there. So you're just going to place your index finger and your middle finger and the thumb on the bottom and just push it right in and push up. Then you can just throw it away. If you do have the intramuscular, which is the needles, those would have to be disposed of in a sharps container. Trying to think if, okay, so let me go back really quickly to this question here so we can see. Okay, so how quickly does Narcan work is the question, and how soon should we administer the second dose? So typically with Narcan, it'll work within seconds. It's important to note that it's very likely that the person that you are administering Narcan to is completely unaware that they are overdosing. So for them, they are feeling really good, you know, really calm, really happy. And then when you're introducing Narcan into their body, they can have some negative reactions. So don't be like standing right in somebody's face. If you do give them Narcan, it's possible they can be agitated, they might fight, they might vomit. There's all different kinds of reactions. They will get very sick. Definitely try to keep them from putting anything else into their body. It's unfortunate sometimes when people are feeling so sick that withdrawal comes on so strong, they want to, use again. Hopefully, you can keep someone from doing that. As far as the second dose, I would say try to wait about 2 minutes. In an emergency like that, it's not going to hurt anyone if you would go a minute and 2 seconds, a minute and 30 seconds. It's hard when it's an emergency situation, and you don't have a watch that you're sitting there like, okay, it's 2 minutes, it's 2.5 minutes, whatever you need to do. Just kind of use your judgment. You'll definitely see. I had a case where I had a young lady who had just gone to the doctor. She had had surgery, and so she was prescribed fentanyl. And then she went with another friend, and they used heroin with fentanyl in it. With this young lady, I actually had to administer 7 doses of Narcan before she even showed signs of coming back. Thankfully, I did speak to the EMS, and she was fine and she lived. It's just, unfortunately, with the synthetics, if it is someone who is using an illicit drug, more than likely you'll probably have to use a couple doses. So definitely be ready for that. Does anybody have any other questions? I kind of went through it fast. I apologize. Okay, so it is safe for children and animals. So again, the only drawback would be that fetus in the first trimester. Ideally, you don't want to have Narcan sitting out on the table or whatever where a child or an animal could get at it. But it won't harm them. There's nothing that it's not going to hurt them in any way. The benefits to intramuscular versus nasal. So for me, my preference is nasal just because it's easy to use. With the intramuscular, and I can show you that if you would like to learn how to do that, so there's a vial, and then there's a needle. So you have to unwrap the needle, you have to unwrap the vial, you have to drop air, then to draw it out. So there's many different steps. With intramuscular, you can, push that needle right through clothing. So once you get those first steps done, it's basically the same as far as speed. There's no there's no data that says that one works better than the other. I have certain participants that will say 100% they'll only use intermuscular or vice versa. Again, there's nothing that says one works better than the other. So hopefully that helps. For me, how many? So for me, I always have several boxes on me just because that's who I am. However, I would say for the average person, depending on what you do for a job, so if you have contact with people who do use opioids, whether it be illicit or licit, perhaps maybe more than one box would be smart. Anybody who's just normal day to day where you might come across somebody, I think one is sufficient. Most places, unless you're in a very rural place where you'd come across these people, the EMS is very quick around here. I would say probably by the time you're administering the second or third dose, you're going to have, you know, the EMTs right there for you. So, okay. So regarding whether the nasal seems to be better than the needle, again, I would say I probably distribute more nasal to people who are family members or professionals. Most people who are using intravenous drugs tend to be more comfortable with a needle, so they select that. As far as injecting that, so in any of your muscle area, so in your arm, in your buttocks, in your thigh, any of those areas is the best place to inject that intramuscular. And I do have that here. So if somebody has a preference and they'd rather have the intramuscular than the nasal, you're welcome to that as well. So one box is one dose, that is correct. You can't do any half doses or anything like that. I've had questions where, you know, people were concerned about children and, you know, just giving them a half dose. It's once you pump it, that's it, that's the dose. So unfortunately. I don't think I missed anybody's questions. I'm just going to look really quickly. So depending on what jurisdiction, some law enforcement officers have, they have ones that are really, really cool. It looks almost like, actually, I have one, I'll show you. So this looks like a little tiny box. It's almost like it feels like a little battery pack. Pull that out of there. And then they pull that off and it tells them exactly what to do. So it basically walks through it and then there's a needle in there and it actually administers the Narcan. Many police departments do use that. Some, off the top of my head, I can't think of any that use the intermuscular anymore. Most of the ones that I work with in Rock or Walworth County and even Greene County tend to use the nasal just because it's quicker for them to, you know, to pull it right off of their uniform or wherever they have it in their belt and administer it. The ones that I just demonstrated, those are very, very expensive and difficult to get. So they work really well as far as people who are not familiar with using that, with using needles, telling you where to put it. However, because of the cost, most police departments don't use those. Yeah, I think the only reason why they used the intramuscular was because that was what was the most available at the time. Now, because, you know, we have a lot more nasal out on the market, I think that was where they're tending to lean towards. Let me see if I can tell you that. So it's 4 milligrams is each dose. So the nasal are 4 milligrams. The intramuscular, I have some in my office right now. They are also 4 milligrams. So they are basically the same. So it's just really about which way the nasal or the intermuscular Narcan is being introduced into the body. It's the same dosage. Anybody have any other questions?
Yes, I do. I can't. Oh, here.
Who wouldn't let you talk?
Where can you get? I'm down to one dose.
Okay. So you're welcome to come down to my office in Beloit. I'm at 136 West Grand. And I can put my information on the screen too if you'd like. You're welcome to, come down and I can get you the Narcan that way. There is a blanket order for everyone in the state of Wisconsin, so you can go to a pharmacy and get Narcan. That was a question that was here. The only issue with that is most pharmacies will charge you for that. It does depend on your insurance as far as what, your co-pays and all that are. We do administer it for free. On Fridays, I have a mobile office, so I am in Janesville. I'm not sure if that's where you're located, but if you get a hold of me, I could meet you somewhere and, exchange that for you as well.
In the old AIDS resource office?
Well, yeah, so we're now Vivint Health, but we used to be the AIDS Resource Center of Wisconsin.
Okay. Thank you.
You're welcome. Thank you. So the question is, what can you expect after you administer Narcan behavior-wise from the person? Each person is different. I would say most people tend to get really sick. They don't necessarily vomit immediately or anything like that. Some people get really angry because, again, they're not realizing what is happening. They don't even realize that they were that close to dying. So just to be prepared. They'll probably be agitated or really, really tired. But again, just kind of keep an eye on them and make sure that, whether they're going with, the EMTs to the hospital, or if they're going to, stay either in your presence or someone else's presence, that someone stays with them and kind of keeps an eye on them so they don't re-overdose. So again, if anybody wants Narcan, I can definitely get that for you. You're welcome to stop in my office. I am here Monday through Friday, 8 to 4. My phone number is 608-774-6202. You're welcome to give me a call. Otherwise, on Fridays, I tend to be mobile. So if somebody isn't able to get to the office, I can meet you somewhere and, drop off Narcan as well. Again, I've got the masks too. So if I'm meeting you somewhere, just remind me that you need a mask as well. Are there any other questions for anybody?
Usually on Fridays, though.
Yes, on Fridays I am mobile. All right. Well, I really appreciate you all attending this training. I think it's really a great thing. Unfortunately, like I shared with the statistics that we see in Rock County, I think that this is affecting a lot more people who are using illicit drugs in addition to illicit drugs. So, make sure we're taking care of the people that we know that, whether it's dementia or other things that they have where they're not realizing that they're that close to an overdose, and just having that Narcan available is amazing. So there's not any other questions. I don't know. Brenda, are you still here?